Commissioners, thank you. Thank you for serving in the trenches of local government. What you do for our people in our counties is very essential. And if I take anything away today, it's that I'm grateful to my York County commissioners, to the mayor in New York City and our city health department, and how they have been working together to address a lot of the things that you are working on back in your counties. And I get the sense that there's great differences amongst our counties, but many things are the same. And the point about collaboration and communication amongst the various levels of government to assure that we are taking good care of all the people in our counties and our Commonwealth, I think is something that you have reiterated over and over again. And I am concerned that you are getting the information that you need so that you can make the best decisions for the people in your counties. We have heard that there's a phased reopening plan. We have not seen the details of this phased reopening plan. And we have recently been told through media reports that counties are not allowed to move into the green phase until all counties in the state have reached the yellow phase. So I guess my question is really multi-pronged, and that is, what are you hearing about this phased process to move from red to yellow to green? And how do you feel about the fairness or the equity in a county like Venango County that has only 7 cases, is doing everything that they're supposed to? I heard great things that Venango County is doing, but potentially could never reach that green phase if Philadelphia can't meet the yellow phase. So can you talk to me about those things, the information you're getting, what you're hearing about the phased reopening plan, and how do you feel in a state that is as large and diverse as Pennsylvania with this type of rumor? Can you confirm this for us, or what are you hearing?
Yes, I will speak real quick on, first, that we could testify on rural broadband if you wanted me to do that with being dropped, and I apologize for that.
Well, as the chairwoman of the Communications and Technology Committee, we will definitely have that conversation in the future, and we do have things in the works to address our connectivity issues. Thank you.
Thank you very much. But being yellow, we have zero idea the future, the possibility, and when we potentially might go green, and what green looks like. And that's somewhat why we're, as commissioners, pleading our case to do this together and be part of the table. I'm very confident in our hospital system here in Venango, which is UPMC, and we have created a partnership that was stronger than ever during this crisis. And we get information and we can work together at this moment in time, being 8 weeks in, and the potential of our businesses that are closed now. I would feel very bad if we were red. But our businesses that are closed now and the threat of their PPP money running out or their loan and grant money running out before they have a potential date of opening, and no answers or no communication on what their future looks like, is a huge concern. So bringing commissioners and those that are on the front lines like us, as well as the senators and reps, to the table to talk about what works best, region and county specific, would be a great opportunity. I know our healthcare facility from the phone call today is ready to handle anything. They're ready to sit down and work together to mitigate Venango County to be a regional and proactive as opposed to a reactive response to our constituents here, and be able to handle it. If you look, there's a hard line between East and Western Pennsylvania on our number of cases. And how can we do this together, from legislature to the governor's office, as well as us, to make that happen? And to your point earlier about Department of Health, there's a strong conversation with regional counties who fall under the State Department of Health. How do we start to do our own Department of Health to start to get some control comparable to Erie or Allegheny County, who get the information real time, who can contact track real time and be on the front end of this as opposed to being on the back end of it, which we are as commissioners right now. I hope that helps.
Commissioner, I really appreciate that answer. And if I could, as a follow-up, just ask, counties that do not have a county health department. I represent a county that does not have a health department. I have a city, a third-class city that has a health department. That's been very helpful in the county response. But how are you getting that data? Are you getting that data? Do you have the data that you need to be able to make the best decisions for the people that you represent?
We found out about our first case an hour and a half before it was publicly announced, and we get our data from press releases just like the general public at this moment in time. And we have 7, so that's what we know.
Commissioner,
Mouth
thank
and
you.
Facebook and the nightly news is where we get most of our information.
Commissioner, it should not be that way. Thank you very much for your testimony. Thank you, Chairman.